अस्सलाम वालेकुम सर।
अमजद साहब नहीं आए? अमजद साहब
नहीं सर, अभी उन्होंने ज्वाइन नहीं किया, वैसे मैंने उनको लिंक दोबारा भी भेजा था।
सर आकिफ
जी सर, यू कैन स्टार्ट।
मेरी वीडियो नहीं आ रही, ठीक है? अस्सलाम वालेकुम, आई एम डॉक्टर moderator of this session, and I will welcome our renowned Professor Dr. Syed Amar Gilani, who is Dean of Allied Health Sciences, Radiological Sciences, University of Lahore. A person, let me say, who did a lot for the education of ultrasound in Pakistan, and his name must be remembered in golden words for the service in this department. Today, he will talk about, I'll request him to talk about certification and licensing for sonologists and sonographers. And there are many questions in the mind that will you are requested to ask whatever is in your mind after he concludes his session. So I welcome my respected Professor Dr. Syed Amir Gilani for his talk. Welcome, sir.
Bismillahirrahmanirrahim. Thank you very much, Dr. Amjad Iqbal Khan. The topic today is certification and licensing for sonologists and sonographers. I will start with the introduction of allied health sciences, and then we'll be covering most of the fields of allied health sciences, including and focusing on sonography or ultrasound. If we look at the allied health career prospects, allied health sciences is a cluster of health professions covering as many as 100 occupational titles, exclusive of physicians, pharmacists, nurses, and a handful of others. Now, the first question starts here that if we talk about allied health sciences, some of the people who are experts in healthcare, they define it as a field of healthcare which deals with everyone working in a hospital except the physician and dentist. There are people who say that it is all the departments excluding the physician. And nowadays people say that nursing departments are a part of medical department, so we don't include them in allied health sciences. So first thing is, who can be a part of allied health sciences? I personally believe, as most of the experts in the world, that anybody who is helping the doctor, starting from the PN to the MS, is a part of allied health sciences. He is helping the physician. So either it is a pharmacist, a nurse, or a radiographer, sonographer, a physiotherapist, whosoever he is, he will be considered as part of healthcare system, and we will be labeling him as in the department of allied health sciences. If we look at health careers which involve physical and mental health, it has got individual and community health, and third part is help both people and animals. So even some of the people, they include animal sciences to be part of a university having allied health sciences. So we can have a department of animal sciences in it. So health related to human being, their physical, mental health, the community health, and the people, the human being who are uh, dealing with animals, especially the pets, uh, can be considered as part of health care careers. Why we choose a health career? First thing is the job security, then is income, geographic mobility, educational choices, intellectual challenges and professional growth, and personal satisfaction. These are the factors for which people usually go for health careers. If you ask somebody who is a physiotherapist or a physician, a doctor or a radiographer, is a nurse or somebody working in the security system of the hospital, they say that when we are dealing with the human being, we are dealing with their lives, we are dealing with the standards of healthcare, we provide quality, we are concerned with different things. So everybody will have a different opinion. We will get some people who will say that if we are working in the health system, the job is more secure. A percentage of people will be considering it for income, that doctors or people who are working in the healthcare system, their income is more, so there will be more money. So they go for money. The third thing is geographic mobility. There are people who would like to migrate to Canada, America, Australia, New Zealand, or they want to work in Gulf for better income. So they will move and they want to migrate. Then are the educational choices. There are people who like to study anatomy, physiology, biochemistry, and medical sciences. And once they finish their MBBS, they prefer to go for two different specialized fields of medical sciences. Similarly, if somebody is a radiology, is a guy of radiological sciences, having BS in radiology imaging technology, will prefer to choose one of the fields in MPhil or PhD, like he or she can go for PhD in ultrasound or PhD in MR or PhD just in X-rays or in interventional radiology. So educational choices are obviously there. I'm dealing with allied health sciences from last 20 years and with different universities from last 18 years. I have seen that people have deficiency of career counseling in most of the developing countries. But if the students are counseled properly, they can choose a better educational career for them. They can have a better field which can suit their personality. Then is the intellectual challenges and professional growth. There will be few people or the parents of the students, they would like to look at the professional growth, how they grow professionally. They will be concerned to quality more instead of money or mobility. And then is the personal satisfaction, which is the most important. I have put it at the end deliberately, because if you are satisfied with your job, with your career, then that is the best reward of your profession. So my opinion is that we must be satisfied with the career, either it is healthcare or it is somewhere else. So as a healthcare provider, I'm satisfied. Uh, Personally, I have satisfaction. Uh, Once I'm satisfied, I can get everything else. I can have intellectual, I can face the intellectual challenges and professional growth will be possible. I will have more jobs opportunities. And obviously, if I'm satisfied, I can give more input and my income will grow. And I can get chances of having geographic mobility. And obviously, educational choices will be there, and whatever I choose will be good for me as I'm a guy having a personal satisfaction. So for the students who are in allied health sciences, I will always advise them to go for their personal satisfaction, choose a field which is good for them, and forget about everything else. The remaining things will come behind your personal satisfactions. Many of the fastest growing occupations are concentrated in the healthcare field. The year 2000 marked a downturn in employment in many industries. Many people, they were losing their jobs, but healthcare was not among them. So there is job security for those who choose healthcare professions. The question most asked is, what is allied health sciences? What career areas are covered under allied health sciences? What are the duties associated with these careers? What is the average salary range? What education or training is required, and who offers the program in our areas, and what kind of person makes a good allied. So first thing is, what career areas are covered under allied health. As I mentioned in the first slide, that there are about 100 fields, 100 professions which are covered under allied health sciences, starting from the management of the hospital, public health, going towards radiological sciences, medical imaging, physiotherapy, medical lab technology, optometrist, and whatever you think about the department of hospital, it will be under the allied health sciences. The duties associated with them are to help the physicians in different ways according to their profession, like occupational health therapist will work for occupational health. A speech language pathologist will be dealing with the speech and language problems. Audiologist will be dealing with the hearing ailments. And similarly, all the fields will be, all the professions will be working their own fields. So directly or indirectly, they will be assisting the physician. What is the average salary range? It depends upon the countries. For instance, somebody who is a doctor and performing ultrasound, is a radiologist or sonologist, can earn a lot in his private clinic. And this government salaries in Pakistan are not that much as compared to the salaries we are getting abroad. We will have a separate in allied health sciences. What educational training is required? In most of the countries, the basic requirement is 16 years education, or previously it was 14 years. Now the BS program is 16 years education. There is Cambridge system. The student go for their A level in pre-medical, and after that they can have 3 years training to have BS. Whereas in countries where we have FSC pre-medical, we go for 4 years training for BS programs. Later on, I will talk about the 5-year programs, their benefits and their hazards also. What kind of person makes a good allied health care worker? As the name shows, it is health care. So if somebody is good, is caring, is good in his profession, then obviously that person can be good in allied health sciences, will be successful. Factors which are affecting healthcare and demand for healthcare workers: increasing number and percentage of older people. So once the older people are growing, the percentage of population worldwide is increasing because of more healthcare, because of more facilities, more advancements. The number of older people is increasing. So for older people, we need rehabilitation, we need nursing care. So the demand of allied health care or allied health sciences is obviously increasing. Then is increased lifespan and improved lifestyle, which is affecting the age. Obviously, the people, when they have better lifestyle and their lifespan will be increased and they will face less hazard. Baby boomers requiring increased medical assistance, and then expanding technology and knowledge in medicine. It is the technology is the tool of a technologist. So it will work as hands of technologist. It will help him to serve the community in a better way. Increasing expectations regarding healthcare. As there is more awareness because of social media, because of advancement, because of access to the internet, people have more access to the information. So they have more expectations from the healthcare system, from the people who are offering allied health care. Then is increasing number of urgent care clinics, nursing homes, and emergency care units. When we have more emergency clinics, more nursing care centers, more nursing homes, old people homes, obviously the demand of healthcare workers will be increased. More nurses and skilled healthcare professions leaving workforce due to retirement. So there are people obviously who are retiring from it. So we need more recruitments. The transformation of the global economy into a service economy. Nowadays, the economy depends upon the services you provide to the community. So that is also affecting, it is one of the factors which is affecting the healthcare demand. Continued advancements in pharmacology and other medical fields is also increasing the demand of healthcare, like pharmacists and obviously nursing and other modalities of health sciences. For education, if I give an example, so we can have, do the programs last for allied health professionals. We can have technicians who have who are offered 1 to 2 years programs like after metric, after 10 years or 11 years of schooling, they are offered 1 to 2 years of courses which are for technicians. Then other technologists. This is a category which is a little bit above the technician programs. The requirements are usually 12 years or 13 years FSC or A level, and it varies from 3 to 5 years in different countries. In America, there are about 128 universities which are offering 5 years optometry course, which is 4 years optometry course after 11 years of after 13 years of A level. So 13 plus 4 will be 17 years. So similarly, there are universities in developing countries where we offer 5 years program after 12 years FSC. So that also makes it 17 years. So the difference is that once you come with A level, which is 13 years education in a developed country, they will be offering you 4 years. So people from developing countries, they looked at the 4-year programs, they copied and pasted and they made it 4 years program. They didn't think that their students had studied 12 years FSE in their countries. And once a student goes abroad for employment or for licensing with 16 years of education, then they will ask him to have a 17th year because the people working there for applying there for licensing had A level followed by 4 years studies. So there are 16 years and 17 years programs all over the world. It is mixed up. The different universities offer different programs, but once we go for licensing, it is better to have 17 years. If you had A level and you did your 4 years program in a developed country, it will make it 17 years. Whereas if you are in a developing country where they call it equivalent to FSC, then your A level is equivalent to 12 years of education. In such countries, you have to go for 5 years. Otherwise, you will have deficiency of practical credit hours, the contact hours of practical. So once there is deficiency, then you have to take deficiency semesters, and that makes problem for licensing for the candidates who are from developing countries. So there are technicians after metric. They can have 2 years. After O level, in some countries, they can have 1 year training. Technologists, which are 3 to 5 years after FSC or A level. Registered nurses, they have 2 categories, especially when I look at the system in Pakistan. After FSC, they can have BS 16 years program, which is a 4 years course, which is the basic BS nursing program. And the other category is 2 years post nursing, which is offered to the people who had 14 years of education. They had matriculation and followed by 4 years nursing training. So their total educational years were 14, which was BSc. So they had to get the equivalence of BS, which is 16 years program. They can register for post RN for 2 years, which is 4 semesters. There are some doctor programs like Form D, which was considered to be part of allied health sciences. And then the pharmacists worked a lot. They struggled for getting the nomenclature of doctor. So it is Form D, which is a doctor of pharmacology, 5 years program after FSC or A level. And they get the title of this. Then we have another title of doctor, which is for physical therapy, which is again 5 years program. And these programs are standardized, having a good quality according to the higher education commissions of the relevant countries. And these are recognized all over the world. But people who were not aware of these things, they had objections on MID, which is the Doctor of Medical Imaging, Doctor of Medical Lab Sciences, Doctor of Optometry. As I mentioned earlier, that there are about 128 American universities who are offering Doctor of Optometry. It doesn't mean that that doctor is in any means comparable with the MBBS doctor. As we can see, the Form D doctor is not comparable with the MBBS doctor. Their field is pharmacy. Doctor of Physical Therapy is a physical therapist. He will be working as in the department of rehabilitation. He will not be working like a physician, but as he or she has spent 5 years in physical therapy, studying the basic things which were taught in MBBS, anatomy, physiology, biochemistry, and all the relevant subjects, which are called basic subjects for MBBS and BDS. So they have all that studies, and then they have specialized courses, which are almost 6 semesters specifically for DPT. So they have they have better approach for rehabilitation as compared to MBBS doctor. Similarly, in optometry, if somebody has worked They are studying the basics for 2 years, in the first 2 years, and then 3 years are spent for optometry. He will be far better than the MBBS doctor who studied ophthalmology in as a minor subject in his MBBS. So it is debatable, and we have to look where the word is going. If we give a title to them, the nomenclature doesn't matter. The things which matter are what are the services they are giving, what are uh, the job structures which are offered by the Ministry of Health or Ministry of Education to these doctors. So these are the programs which are offered. We have DDNS, Doctor of Diet and Nutrition, and OD. The next thing is, where can they work in a health career? They can work in hospitals, like in surgery, they can work women's clinic or women hospital. They can work in children hospital. They can work in the extended care, psychiatric, cancer, etc. Whereas in private clinics and with the doctors, they can work, the allied health professionals, they can work with the doctors and with the dentist because they will be assisting them. So we don't have to forget that allied health sciences people are assisting the physicians. They are not competing the physicians. They are their hands. They are their stethoscope. So they are going to help them. They need respect. So for which we give them good nomenclatures so that they can feel better in the atmosphere of the healthcare. Then they can work in clinics. They can work for community services in the public health. Education, they can work as teachers in home healthcare, like for old people services, home services. They can provide like healthcare, nursing, especially nurses, rehabilitation guys. They can work, the audiologists. They can provide services which are in-home services. As our topic is mostly about sonologists and sonographers, there are some qualifications in ultrasound which we see are offered by different universities or degree granting institutes in Pakistan and abroad. So many universities in UK, they are offering PhD in medical diagnostic ultrasound. They are offering master's degree in sonography and health sciences. There are degrees which are like PG diplomas in sonography, specialized diplomas in sonography, like somebody going to have 6 month or 1 year diploma, which is for the rheumatologists or orthopedic surgeons. So they are taught how to perform the musculoskeletal ultrasound. They do diploma in that. They learn how we use color Doppler in the musculoskeletal system and how we use the interventional procedures. There are some certificate courses in sonography also. Somebody who is a doctor or who is healthcare professional can have a basic 4 weeks awareness course somewhere in the world, and then can scan his or her patients. And better is not to stop there. It is better to learn after certificates, go for diplomas and keep learning, because a healthcare profession always need continuous medical education to improve his or her qualification and knowledge. Then we have bachelor's degrees in sonography and ultrasound associate degrees, which are the 2 years programs after FSC, which are also offered in Pakistan. They have associate degree programs, ADPs, and there is a need of associate degree programs for ultrasound. Then is how we get the license. For instance, if somebody has, or in England, can go for national board examination in optometry and can get a license to work as doctor of optometry. The optometrist has got some of the privileges and there are some limitations. They are not the competitors of the ophthalmologists. They are the right hand of the ophthalmologist, but in America, they get doctor of optometry degree. Then they go for licensing exam, and they can have individual national, state, or provincial requirements. Accreditation and certification. To participate as a sonographer in Australia or New Zealand, you must complete an accredited course of study, which includes a comprehensive clinical training program of around 2,200 hours, equivalent to 3 days per week over 2 years. So if the program is 5 days a week, there must be uh, 2 years program with 3 days practical training. It means if it is 4 years program, there must be 1 day per week for the practical training. So we have to complete 2,200 hours of practical. This is the same which we started offering in 5 years program in some of the universities in Pakistan with the title of doctors. So the basic aim was to provide these. Otherwise, in 4 year programs, most of the universities are not going beyond 400 to 500 hours in whole of the degree program, which is not sufficient to train the healthcare providers. Courses can be undertaken to become a general sonographer or a discipline-specific sonographer, for example, cardiac, vascular, musculoskeletal, and obstetrical ultrasound sonographer. Most accredited courses are only offered at a postgraduate level and require another health of science undergraduate qualification. There is currently one undergraduate available in Australia. Let's see some of the examples. This is Joint Review Committee on Education in Diagnostic Medical Sonographer, which is in Australia. The two credentialing bodies in the United States for sonographers are the Cardiovascular Credentialing International, established in 1968, and American Registry for Diagnostic Medical Sonography, ARDMS, established in 1975. We also have JRC for Diagnostic Medical Sonography in Australia and New Zealand. The credentialing bodies, these two bodies in the United States, as I mentioned earlier, are ARDMS. The Commission on Accreditation of Allied Health Education Programs. This is covering whole of the Allied Health Sciences program. It is called CAAHEP, which is Commission on Accreditation of Allied Health Education Program. Is the most widely recognized accreditation agency when it comes to diagnostic medical sonography or ultrasound technical education programs. While it currently accredits over 200 sonography programs, they accredit the institutions, universities. A handful of states do not have CAHEP accreditation schools, and only a few accredited institutions offer online ultrasound programs also. So keeping in view, there is a need of Punjab Commission on Accreditation of Allied Health Education Programs, which can accredit different institutions, which can accredit the educational programs. It can be under HEC or it can be under a separate council. Then we need National Commission on Accreditation of Allied Health Education Programs, which we call NCAAHE. So these two things are needed in Pakistan. Even in developing countries, I have worked in Sudan and in different African countries. There we also need their national and state or provincial commissions for accreditation of allied health education, because it is the most growing field in healthcare. The RDMS credential offered by the American Registry for Diagnostic Medical Sonographers certifies expertise in the field of diagnostic medical sonography. It offers different course, different exams. It was established in 1975. Worldwide, over 90,000 medical professionals have been certified by the ARDMS, representing a variety of specialization, including cardiac, vascular, obstetrics, gynae, sonography. Now they have musculoskeletal also, and there is also one for physicians. ARDMS is accredited by several prestigious and reputable bodies, including the International Organization for Standardization, National Commission for Certifying Agencies, and the American National Standard Institution. So once you have license of ARDMS, there are chances that you can apply everywhere in the world to get job as a registered sonographer. How do we earn ARDMS certification? In order to earn certification from ARDMS, individuals must take the sonography principles and instrumentation examination, which is SPI. Certain specializations require additional testing within 5 years of passing the SPI. So once you pass the physics exam, you have 5 years to attempt for a specialization course. You can attempt for musculoskeletal or for vascular or cardiac or OBGYN or abdomen, whatever you want, you can apply for specialization. But for all the specialization, you have to go through SPI first, which is the mandatory part. The most recent statistics from the ARDMS shows an SPI pass rate of 75% for the first time test takers. So it is not very easy, but it is very good examination. It is data-based, multiple choice questions, scenario-based questions. So it is helpful to get registered. Professional certifications offered are the ARDMS offers many different credentials. Sometimes only one major examination is required to receive a certificate, while the other cases in general examination as well as specialty examinations are required. For instance, we can have RDCS, which is one of the license offered by ARDMS. ARDMS is American Registry for Diagnostic Medical Sonographers. So the main thing is SPI. You pass the physics, principles, and instrumentation. Then any specialization you can choose, like you can appear for abdomen. They will call you that you are a registered diagnostic sonographer in abdomen. You can have breast, you can have fetal echo, you can have obstetrics, you can have pediatric sonography. So similarly, you can have the cardiac sonography. Then we can have adult echocardiography, pediatric echocardiography, and fetal echocardiography. We can have vascular technology also, then musculoskeletal. They are also offering ARDMS exams for midwifery sonographer certificate. So if somebody is midwife, like we have got here midwives and LHVs, they can, once they have BS or BSc, I mean 14 years of education, they can have 1 year experience of ultrasound and apply for licensing as midwife sonographer examination. No special examination is required, just they appear for one exam, which is the main exam, and they get the certificate. So the question arises, like ARDMS, do we need PRDMS, Pakistan Registry for Diagnostic Medical Sonographers certification? The answer is yes. If we don't register diagnostic sonographers, even the qualified sonographers in Pakistan or in developing countries will face a lot of problems which they are facing nowadays. It is better to have accreditation like in Australia we have. In Pakistan we can have sonographer accreditation. We can form a registry like this and start taking examination. We can have some of the criterias for radiologists, for sonologists, I mean the physicians who are performing ultrasound, the technologists who are the sonographers, whatever degree they have, We can have eligibility criteria. Once they fulfill the criteria, they can appear for this licensing exam, and the licenses, the license can be awarded by Pakistan Registry for Diagnostic Medical Sonographers. The health ministries have to look into it. Otherwise, there will be mushrooming of ultrasonologists in the country. If we look at dual certificate accreditation with the Australian Sonographer Accreditation Registry, which is called ASAR, it is like ARDMS, and be listed in the ASAR register for accredited medical sonographers. Graduates from an ASAR accredited course is required to become an AMS. So first, the institution which is offering any education will be accredited by the council or by the registry. And then second thing be the people who are qualified, who have graduated, they will be appearing for licensing exam. Once they pass, then they will be allowed to practice in their own category. The categories can be sonographers, sonologists, and radiologists. If we look at our radiology programs, lot of things are there, and in 2 years of DMRD, it is difficult to get all the modalities of radiology. We cannot get grasp on it. We cannot be expert. So it depends on your interest. Some of the people, they have interest on mammography or fluoroscopy. Some are good in MRI, some are good in CT scan, and there are few people who are good in ultrasound. So for ultrasound practice, I will always suggest that even the radiologist must have licensing exam like a physician. And we can have a proper, through the registry, we can have a proper training and a proper data-based exam for everyone. While completing an accredited course of study, students should apply for registration as an ASAR accredited student sonographer. Once they pass, they must pay their annual fee and complete at least 60 hours of continuing professional development. So they need CMEs in 3 years. In 3 years, they must attend workshops or conferences or training programs of 60 hours. So it will be 20 hours per year, which is not too much. And then they pay the renewal fee and they get their license renewed. ASAR is the Australian Sonographers Accreditation Registry. Is sonographic education accredited? In the United States, the most widely accepted sonographic education is provided by CAHEP or JRC DMS accredited programs. These are the two agencies which are the commissions which registered sonographers. So is diagnostic medical sonography accredited? The recently proposed revisions to the standards and guidelines of accreditation of education programs in diagnostic medical sonography include 2 new learning concentrations, breast sonography and musculoskeletal. These are added, like as I mentioned in ARDMS. Then is case. If we look at UK, and the system they have got is Consortium for the Accreditation of Sonographic Education. CASE is an organization that exists to accredit sonographic courses delivered within the UK. CASE works closely with the universities and other higher education institutions to ensure the highest standards are met. So the CASE will be working with HEE and other partners, publish in CASE standard of sonographic education. This document describes the standard education program should meet at academic levels of 6, 7, and 8. The case standards are intended to be read in conjunction with the vision of the future of NHS, which is the National Health System, ultrasound service provision. This outlines the context of developments from the perspective of service delivery. Register of Sonographer, Public Voluntary Register of Sonographers. The College of Radiographers, we are talking about UK, COR administers a public voluntary register for those individuals practicing as sonographers. Individuals may have their name entered in this register, which will help members of the public and employees is appropriate fight. If you look at New Zealand, they must hold annual practicing license, which is called APC. They have got New Zealand Medical Radiation Technologists Board. The Medical Radiation Technologists Board, MRTB, set the conditions that sonographers must meet for when they are applying for an APC. Issued for up to 12 months, sonographers must renew their APC with the MRTB annually in February and March for the next year. When reviewing their APC, sonographers must have 60 hours of continuing profession, as I mentioned about Australia and UK. So, which are also needed for 3 years with a minimum of 10 hours in any 1 year. The last thing is the Society of Diagnostic Medical Sonographers. It is a professional membership organization founded in 1970 to promote, advance, and educate its members and the medical community in the science of diagnostic medical sonography. It is something like AIUM, American Institute of Ultrasound Medicine, or we have a society, Ultrasound Society of Pakistan, or Radiology Society of Pakistan. So the SDMS is the largest association of sonographers and sonography students in the world. There are a lot of people who are registered with it. So the need is that in developing countries, we need to have physiotherapy board, like in Australia, we have physiotherapy board of Australia, we have optometry board of Australia. All these boards can be under one council or under one registry, whatever we call. This is midwifery council. So if you look at council, there are many councils in different countries, and the situation in Pakistan is that if we talk about education, there are many educational programs in ultrasonography or sonography, like other fields of applied sciences. There are training programs, but still there are weaknesses in trainings. We need to improve these training programs and synchronize them with the educational programs. Accreditation is from HEC. The problem is that most of the allied health sciences faculties are not in the charter. There are delays from the government, and lot of obstacles are there. For many years, the files are not moving from one office to other office. The things are disturbed, and students have to suffer if the programs are not accredited. So we will request all the authorities to have parameters and to enter if somebody is fulfilling their requirements and they are up to their standard, they must not waste time for adding allied health faculties in their charters. So we need faculty of allied health sciences or departments of allied health sciences in the charters of the universities. Licensing is another problem. If there is a council like pharmacy council, nursing council, they give you license. But if you don't have a proper council for other fields, as I mentioned, there are about 100 fields, 100 subjects or 100 tracks of allied health sciences, there will be problems. Similarly, there is no licensing body or board for ultrasonography. There are demands, lot of demands if we produce 2 years, if we produce the ADPs, associate degree people, 14 years of education, like after FSC, they can have 2 years fast tracking. Most of it, 70% of it is the technical training, hands-on training. They can get a lot of jobs abroad and the country will get foreign revenue against it. There are some restrictions also. The genuine restrictions must be followed. And for our rights, we have to speak up. We have to give the wake-up calls to the community to work together and to get our rights. And we have to keep us away from the from the things which are not allowed by the authorities. Councils in Pakistan relevant to the medical field, the health sciences are Pakistan Medical Commission, which is the medical council, and it is recently made. It is just a mistake here. I wrote, instead of commission, I wrote council. It has just replaced Pakistan Medical and Dental Council. Then is Pakistan. Then in last 4-5 years, Pakistan Technology Council was introduced, and it is dealing mainly with engineering technologies. There was a part of medical technologies, but then people tried to have another council for allied health sciences, and still we are waiting for its recognition. So what we need Pakistan Allied Health Sciences Council, PAHSC, having boards of each subjects under it. For allied health professionals, registry, accreditation of educational institutes, and qualification of allied health professionals. These are the main two aims of this Pakistan Allied Health Sciences Council. If we don't have it, there will be problems with the allied health sciences, with the standards of the graduates passing out, with the number of students the universities are taking, the practical hours we are offering them. There will be problems with everything. So there is a need of Pakistan Allied Health Sciences Council. What are the recommendations? My last 3-4 slides. Recommendations for specialists. For those who have qualification, like somebody is orthopedic surgeon, rheumatologist, or is obstetrician, gynecologist, so their education is there. They can have short courses. They can have 4 to 6 weeks short training courses to use ultrasound in their field, or they can have weekend 6 months diploma courses. They can register with the council if there is any allied health council or board for ultrasound registry. They can get license for it. There will be jobs for them, because if somebody is a gynecologist or obstetrician and is good, is having good qualification, which is registered, and there is license, can get a good job as a gynecologist, because she will be she will be able to perform ultrasound of her own patients. Then community services are important, and they must have about 20 CME per year, 60 in 3 years, minimum of 10 hours per year. So total in 3 years is 60, which is internationally required. So if we adopt all these things, we can train our specialists to use ultrasound. Medical Dental Council or Pakistan Medical Commission, and they want to perform ultrasound in their clinics on their patients. So they need to have a qualification. I will always recommend to have a qualification after MBBS. They must have about 2 years degree in radiology. Radiology means lot of subjects like X-ray, CT, MR. They need interventional radiology. They also go for for ultrasound, for color Doppler, for X-rays. There are about 7-8 modalities. In 2 years, they have to study. But if somebody is MBBS and is having exclusive 2 years training, evaluation by the experts, and the degree is recognized by the Higher Education Commission of Pakistan, they must be registered by the Pakistan Medical Commission or by allied health sciences people, whatever is the governing body. So they must register which we need, and we have recommendations that the specialists can have short courses. They can the patients, and we can start either by PMC or by any council, whatever is can offer licensing for the specialist. For instance, gynecologist can get training, 6-month diploma, or whatever is recommended according to the protocols and guidelines. They can get the qualification, get registration through licensing. There will be more jobs and there will be more satisfaction scan their patients. For sonologist, I was talking that if somebody is MBBS and having 2 years training, like which is equivalent to MPhil or MSDU, MS, which is Master of Science in Diagnostic Ultrasound, which is 18 years education, they must sit for a licensing exam from PMC, and then they must get their license. Because if there are just few thousand people, like 2 to 3,000 radiologists in about 22 to 25 crore people, which is 250, around 250 million people in Pakistan, they cannot fulfill the requirements of ultrasonography because it is a need. Every physician must have a portable small probe like machine, ultrasound machine in his pocket, like the pulsimeter, like stethoscope. All the physicians must have it. So once they are there, they must know how to use. So for sonologists, we can go ahead, and I will recommend their registrations after their licensing exam by Pakistan Medical Commission. Then is the sonographers, those who have 16 years of education in Pakistan or in developing countries like Sudan, Somalia, Ethiopia, other countries, Egypt. They can go for licensing exam, like we have ARDMS, which is based on 14 years of education. So in the beginning, we can start offering for 16 years, which is after FSC, if they have minimum 4 years of education, BS ultrasonography or BS RIT radiology imaging technology, or BS MIT, or they have MID, which is 5 years program. So they can sit for licensing exam. And this will create a good atmosphere for the people who are concerned with sonography or in the country, and it will help the government to control all these things. Otherwise, there will be mushroom growth. So it will that creates great waves. I have thrown a stone in the ocean, and I hope it will create a wave, and it will bring good results for the community, for the people who are working, who are the part of allied health sciences in the world, and especially in developing countries and in Pakistan. It will create awareness in the government level, at the level of the authorities, so that they start registering a lot of revenue for the authorities by providing courses and by registering the people and offering them licensing for it. It will create a lot of opportunities for our youngsters to go abroad to work in the allied health fields, and they can bring lot of revenue for the country. Thank you very much. Any questions, sir?
Jazakallah, sir, a very wonderful lecture. You gave a very detailed overview, and I don't think you left any stone unturned in this regard. The lecture is self-explanatory. But even then, there are a few questions. Like first, I'll ask a question from a participant. Then there are other questions too. Miss Uzma is an LHV, and she says if she can go for BSc in sonology and work legally. Sir.
Yeah. Yes. If somebody is FSC and or her LHV program is equivalent to FSC by the Lahore Board of Education, there is equivalence for different diplomas, then she will be able to register for BSc program if offered. And we don't have 2 years BSc program. It can be under the umbrella of associate degree programs. Nowadays, we have 4 years. So if she gets equivalence of LHV program, that it is equivalent to FSC, she can apply for BS in the university BS, and once she finish, then this is the point which diagnostic ultrasonography or in any field of allied health sciences. At moment, there is no such rule. So at moment, I don't believe the Punjab Healthcare Commission will allow her to perform ultrasound on her, even on her own patients. So we are yet to get approvals. We are waiting for criteria, for the protocols, guidelines for those who are qualified. They are qualified ultrasonologists or ultrasonographers.
Hello. Sir, आपकी आवाज. Sir,
Yes,
आपकी आवाज बंद
yes,
होगी.
sir.
Sir, thank you very much.
Question?
There is a gentleman, Swasan Ahmed, from Sudan, I suppose. I think he's asking for students from Sudan, education in Pakistan, perhaps.
Yeah. They from 2002 to 2000 coming to Pakistan to my institute for training of ultrasonography. Then we started BS and there were few Sudanese who were coming, and from last 3-4 years we have some Nigerians who are studying programs at University of Lahore. If they want to get short training programs, they can come to Afro-Asian Institute of Medical Sciences. There will be few online training programs in which we will have different partners. Like if there is a university which is offering a certificate or diploma, and their part will be to evaluate the people at the end, and we give online lectures and they get practical training in Sudan, or we give them some training online. So that will be short courses like diploma course or certificate courses which are already available. But if they are interested in BS or MS or MPhil or PhD, they come to University of Lahore. Then there are some other universities that they can come and they can get this qualification in Pakistan.
Right, sir.
Yes, sir.
So the questions always asked are, the people are not afraid of getting education. But after getting education, when they don't find job, they are not counted legal. That creates a problem. You very nicely mentioned the need of a council like ARDMS in Pakistan. But the thing is, there is a clash between PMC and HEC. HEC recognize the courses and people can get job abroad by qualifying their licensing exam. Here, what people should do, both doctors and non-doctors. And a related question is, why an RDMS can do ultrasound and not a postgraduate medical doctor? Why a DMRD cannot, sorry, why a DMRD doctor is allowed to do ultrasound and not a MS masters in ultrasound can do ultrasound legally? Over to you, sir.
So what I got from your question is that you are saying that why why a sonologist having so, licensing is that if somebody is very good in driving but not having a driving license cannot drive. Similarly, if somebody is a good radiologist, he or she knows uh, everything about radiology, but if there is no license, he or she cannot perform. So for DMRD, either it is DMRD, it means MBBS followed by 2 years training and qualification, getting a degree of DMRD, which is a diploma, 2 years diploma, but it's equivalent to MPhil according to HEC of Pakistan. If somebody has done MBBS followed by 2 years MSDU or MPhil in ultrasound, it is same. If there is licensing, then both can go for licensing exam. Those who pass the exam, they must get license. Otherwise, either they are DMRD or non-DMRD, they must not be allowed to perform ultrasound and let the people to appear. Those who pass the exam, they get the license and they practice. Similarly, if somebody is DMRD and has got license, they can work anywhere in the world wherever it is accepted. Like in Dubai, now they accept ARDMS registered people. So if they work in Pakistan, they will not be allowed because we don't have a council, we don't have a registry, we don't have protocols for it. So there is no criteria here. It depends that as you say that might has the strength. So the people work themselves and there are no rules. Nobody is there to legalize them to give them license. So better is to prepare, as you just mentioned, to have a council or a registry, take exams, give license, let them practice. Those who will be good, they will be passing. Either they are physicians having 2 years MS degree or they are physicians having 2 years DMRD. We are not exempting the DMRD from the licensing exam. This is just a proposal, a suggestion. That can be my individual, my personal suggestion.
Thank you very much, sir. This is true what you are saying, but there is no role of the graduates in making a council. There is no role of a graduate or a postgraduate in ultrasound after MBBS or otherwise to make an official CME program. We need a struggle, perhaps, to make struggle for such a body to be made and accreditation institute to be made so that people can apply and go for the licensing exam. On the other hand, in USA, what I know, people who have done MBBS or doctors, their accreditation is done on the basis of their experience and years of education and working too. Is there some sort of thing like that can do in Pakistan and how to go for that?
Yeah, we can count. It depends upon the council. If they make a criteria that they have some marks for the experience. For instance, somebody is doing ultrasound from last 20 years. So out of 100, for instance, I'm just giving you
Right.
example. that we give 10 marks for that 20 years of experience, and somebody have to get other 60% marks uh, from the remaining 90 marks in the practical assessment and in theoretical multiple choice assessment, which depends whatever criteria they want. We can provide them experts. We can make a committee, ad hoc committee to prepare the things. We can provide them hundreds and thousands of questions in ultrasound so that they can give them through the software. They can assess them. We can even provide them the softwares like the softwares of the ARDMS. So as I was mentioning, you can see there are 7 stones in front of you in the last slide. The tiniest one I have thrown in the ocean. The remaining 7 are for my students, for my colleagues. They can start. And I hope
Sir,
Dr. Amjad Iqbal will take the last one, which is the heaviest one.
sir, I don't agree. I don't agree. You throw many stones and you are working like anything since years and years and years in Pakistan. And mm, let me say, even your work has gone unacknowledged and not has been acknowledged to that extent, to extent of a legend. I would request you, so when you have done so far, you have gone so long, you have educated so many people, we should make a way to go ahead. Yes, I will be going with you to make somebody, some people recognize the fact that people are getting education, people are paying heavy fees in the universities, and then they get unacknowledged. The question only is non-coordination of PMC and HEC. If there you can lead, we are with you.
I think HEC is very strong. Their parameters are very good. I will always go with them. For
Yes.
PMC, as they are new, and I have been there once, I have seen the people, they are very much educated and they seem to be loyal and honest. And I hope they both commissions will synchronize for all these things and things will improve. It will take few months, not contact them to provide them the things. And if they need our assistance, we can prepare registry, we can prepare the council documents. Even the licensing exam, we have all the things we can assist them to. We want to assist them. We don't want to fight with them because by fighting we will lose everything. It is better to unite, to work together for the nation. Then we will get the standards.
So, so that's very great. And I hope in your leadership and combined effort of all the people who graduated, who did higher studies in ultrasound and allied health fields, like sir, there are councils for pharmacy council is there. Even in our country, homeopaths and hakim, they have allowed by through their councils. We should go forward with more forceful effort for a council of allied health sciences.
Inshallah,
And I
inshallah.
hope, inshallah, in your leadership, one day we'll be successful. Thank you,
Thank you.
sir. Over
Thank
to
you.
you.
Thank you very
Sir,
much, sir. Thank you.
sir, thank you very much for your presentation and hope you will be benefiting the people with your knowledge and experience like that always. God bless you.
Inshallah. Thank you very much, sir.
Thank
Bye
you.
bye. Bye bye.
Thank you, everybody. Bye bye. Thank you.